Welcome Dr. Shetty to yet another episode of Editor Speak. Sir, what is a high-risk consent?
When a necessary investigation, treatment or an intervention is planned and when there is a very high possibility of a complication occurring, then it becomes incumbent on the doctor performing the same to explain the complication or the risk in detail.
Okay.
Here, the details have to be told in an elaborate manner and only then a consent is taken, and this is known as a high-risk consent.
Sir, so what should a valid high-risk consent contain?
A valid high-risk consent should have the name of the patient, the purpose of the investigation or the intervention. It should be very clear whether it is for therapeutic purpose or a diagnostic purpose. It should have details of the complication or the risk associated with the intervention. It should have the measures which will be taken when the complication occurs, or the availability of the infrastructure when the complication occurs. More than that, if the relatives or the patient's relatives have any questions, it should be answered in detail. This consent should be elaborate. If any of the above ingredients is missing, it is not a valid consent. This is specifically demonstrated in a recent judgment from the National Consumer Commission, where a patient with a lump in the buttock was brought to the vascular surgeon. He diagnosed it as a AV malformation, for which he advised a AVM embolization. Post embolization, the patient developed gangrene. The patient was transferred to another hospital, and above knee amputation was performed on the child. The relatives of the child filed a case of negligence against the vascular surgeon. The vascular surgeon in defense stated that he had taken a high-risk consent where all the risk and complications were explained to the patient's relatives. The court, on perusal of the medical records, noticed and observed that the risk and the complications were not clearly told or explained in detail to the patient's relative. This, the court said, was a deficiency in the duty of care. For this reason, the vascular surgeon was held negligent.
Sir, so what would be your advice to doctors, especially when it comes to a high-risk consent?
See, if there is a high possibility of complication, a high-risk consent has to be taken. Or if you expect the consequences of the complication are serious or the side effects are serious, a high-risk consent is always advisable.
Sir, hope your observations regarding this high-risk consent is educative and informative for doctors in their day-to-day practice. Thank you.